Hello, viewers. You're welcome to our enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is Dr. Ubong Ekbene, a consultant and neurosurgeon and a lecturer with the University of Uyo. In the last video, we had looked at some of the risk factors for back pain, and we had considered proper lifting technique, proper sitting and lying position as interventions that can reduce the risk of developing slip disc and back pain as a result. Today, we are going to look at another cause of back pain, and that is infection. There are several causes of infection. Bacterium could be caused by fungi, could be caused by mycobacterium, and we're looking at mycobacterium as a cause today. It causes a condition called Pott's disease. Pott's disease is caused by a microorganism called Mycobacterium tuberculosis. I'm sure many of you have heard about the disease tuberculosis that affects the lungs, can cause cough and other symptoms. Now, the same organism that causes that disease that affects the lungs can also spread to affect the spine. So when it affects the spine, it is called Pott's disease. Pott's disease, like I said, may begin from the lungs and spread through the blood, a process called hematogenous spread. Hematogenous means spreading through the blood vessels. It could also spread through an infection that affects the abdomen. People who consume raw milk directly from the nipples of the cow and they drink it without getting it pasteurized, that can contract this disease that affects the viscera organs in the abdomen, because there's a vessel, the vein that connects with the abdominal viscera with the spine, and these veins are valveless veins of Betson. This organism can spread through those veins which connects to the spine and cause this tuberculosis. So when you drink raw milk directly from the cow, know that you are at risk of developing this. If you come in contact with somebody who has an active tuberculosis infection and you contract it and it affects your lung, it can actually over time affect your spine, leading to Pott's disease. So when this disease occurs, how does it manifest? Patients can present with symptoms of back pain as a result of the gradual destruction of the bones of the spine. When this happens, the pain is persistent, maybe worse at night, and this pain may be associated with some constitutional symptoms like fever. Patients may lose weight, may sweat excessively, especially at night. The patient also may develop certain kind of symptoms like deformity of the spine, an abnormal curvature of the spine as a result of a collapse of the bone that has been destroyed by the infection. As this bone collapses, it can push on the spinal cord that is just behind it, and that itself can cause the limbs, the lower limbs of the patient to become weak. May also present with problems with controlling stool and controlling urine, and sometimes erectile dysfunction as a result of a compression of the spinal cord or the nerve roots. So when this happens, then the patient's symptoms has become complicated. But in the early stage of the disease, where back pain is the main symptom, it may be difficult to differentiate between a degenerative cause and other causes. But when some investigations are done, like blood tests and some other specialized tests that can detect the presence of this Mycobacterium tuberculosis in time, treatment can ensure that cure is achieved. And these treatments usually require medications, and these medications are free. They are supposed to be given to patients over a prolonged period of time. Why it is so important to receive treatment early is to prevent the complications that we have talked about: destruction of the bone, collapse of the bone, compression of the spinal cord, and weakness of the limbs and other dysfunction. When this happens, it becomes more difficult to treat. Medications alone may not be enough. You now need surgery to either drain the abscess that may collect there, called cold abscess, and sometimes you require fixation of the spine in order for the patient to be able to walk. So, why is this very important? There's increasing incidence of Pott's disease, and that is because of the increasing incidence of HIV and other immunosuppressive conditions that can predispose to the development of this condition. Vitamin D deficiency also is another risk factor for it. So I want to encourage you to share this video to somebody who may need help, because if it is treated in the hospital in time, it can save the patient from serious complication. But if it is not treated in time, then the complications, when they begin to arise, becomes more expensive to treat, and sometimes it may not be reversed when neurologic symptoms set in. So if you think this video is useful, you can like it. You can also forward it to those that you think may be of help to. And I look forward to seeing you in the next video. Thank you.